Health and wellness are the most important things in your life. It impacts on how everything else happens and is perceived by you. Most of the times, do we give it much attention as we should? That's why Capuchin TV is bringing you this health program every Friday, starting from 9 a.m. to help you embark on the journey to wellness and living a healthy life. It is important to point out that mental health is more about wellness than sickness. Self-care is not selfish. Some of the factors that can make a big difference in health wellness are diet, enough rest, exercise, posture, and avoiding use of alcohol. Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth. Capuchin TV.
And forward ever, backward never. So move ahead. Ahead, ahead.
Endelea kutazama Capuchin TV. Kitambulisho Katoliki. Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth.
A very good morning to you, dear viewer. Thank you for joining us here on another episode of Health Corner Show right here on Capuchin TV with me, Maureen Kimani, where we bring you conversation on your well-being. And of course, we say your health is your wealth. And we bring you a different conversation, as I said, of health matters and of course mental awareness, mental health awareness. And we have a beautiful guest right here in our studio who is a very phenomenal woman, beautiful, talented, name them all, and of course our mental health practitioner, that is Veronica Maweu, who is our special guest today, and she has been helping us to understand more about our well-being. And of course our conversation today is schizophrenia. Maybe you've ever heard about this word, you've ever come across about it, or in case it's new, don't worry about that, because she's going to help you understand more about this conversation. And just to give you a research about this schizophrenia, is that globally about 1% of the population is diagnosed with schizophrenia. What are we talking about? What is it all about? Who does it affect? What are some of the types, the causes, and symptoms? Well, we have you covered right here on our Health Corner show. Very good morning, and once again, welcome to the conversation. Hi, dear.
Hello.
Good morning.
Good morning to you.
It's good to have you here.
Same.
Another day, another one, and of course another one.
Yeah.
Yeah, karibu sana.
Asante.
Have you been feeling, and how do you feel about this day and the conversation today that we are having?
It's an interesting topic. Is one word which a lot of people find very difficult to pronounce.
I tell you.
But we are going to tai chambua. Yes.
Okay, karibu sana, and thank you so much for making time to come here to our Health Corner show.
Thank you.
Yes. Let's now begin with this conversation. Help us understand, what is schizophrenia?
Okay, so schizophrenia is a condition. It's one of the mental disorders we have. And it is one of the, let me say, magnified one, because when I explain about it in layman's terms, people are going to figure out what exactly it is. But let me not start with that introduction. Let me start by defining it according to WHO. It is defined as a condition that is that causes psychosis. Okay, I will define later what psychosis is. But according to WHO, it's a condition that causes psychosis and is associated with general impairment in functioning. This is impairment in personal functioning, in corporate functioning, in family associations, inability of a person to take care of themselves. So that is according to WHO. According to our Diagnostic and Statistical Manual of Mental Disorders, which we are currently at DSM-5, we define psychosis as a condition that is characterized by, again, psychosis, okay? So schizophrenia is characterized by psychosis. Now, what is psychosis? Psychosis is being out of touch with reality, okay? So here we'll be talking about things like hallucinations. Hallucinations is distorted perceptions. Either you're seeing things that other people cannot see, you're hearing things that other people cannot hear. Then we also have delusions. Delusions are distorted belief systems. So a person is believing something that is not right or is distorted in a way. Eh? Somebody will come and tell you they are Jesus Christ. So that is a distorted belief system. Then we have things like disorganized speech, disorganized behavior, inability to express emotions. They'll have like blunted expressions. You know, your people are crying and they are very happy laughing. Yes, so basically that is a glimpse of what schizophrenia is. Yes.
Okay, and I understand that the month of May is set aside to create awareness on mental health. And who does it affect, this schizophrenia?
Schizophrenia affects people across the board, women, men. It's a bit difficult to detect in children, but as they grow up, you're also able to pick it. That is early teenagers and early adulthood. So it can affect anyone. Yes.
Okay, and between men and women, who are mostly affected with this schizophrenia?
Well, according to studies, men have been shown to be affected more, but in my years of practice, I'd say it is affecting us equally, or close to equally, because there is men and women affected by schizophrenia. I don't want to lie on one gender, and people will get it confused. So let's just say all of us are
at risk of,
yes, at risk of schizophrenia.
Okay.
Yes.
And you talked about affecting this schizophrenia affecting people globally.
Yes.
How common is this condition?
According again to the WHO currently, 24 million of us in the world are living with schizophrenia. And when you break it down, it is 1 in every 300 people. It may look like a big number, but it is not, given the type of condition schizophrenia is. So it's 1 in every 300 people, and in adults, it is 1 in every 222 people. That is the current studies. Yes.
Okay. I'm sure you mentioned about these hallucination and all sort of things. How does this condition affect someone's body?
Okay. So there is changes in the brain chemistry. There is changes in the structure of the brain. That is why even when you study about how they conduct research, you see them studying brain imaging, because there will be changes in the brain structure of a person with schizophrenia vis-a-vis a person who has a normal brain, or rather is normal. Yeah, it will also affect the brain chemistry in such a way that we have these chemicals in our brain, dopamine, glutamate. So there will be effects on how the brain chemistry is. So that is how it will affect physiologically. And then now, of course, there are the subsequent behavioral effects that will be seen as a result of that. Yes.
Okay, and what are some other conditions or disorder related to schizophrenia? we have the multiple personalities. What is the difference between schizophrenia and multiple personalities? Because you talked about having those voices from your head. You have like, you hear like people are talking to you and you have a conversation.
Well, we have a group of personality disorders. We call them cluster A, because we categorize personality disorders in clusters. We have cluster A, B, and C, okay? Now, in cluster A, we call them odd and eccentric behaviors or personality. So those ones are we could say they have some symptoms which are also closely related to schizophrenia, but then they have not gotten to that point to be categorized as schizophrenia. When you talk about multiple personality, or rather what you call it's dissociative identity disorder. Yeah, currently we call it that, dissociative identity disorder. It's a disorder in which a person has like what people would commonly say a split personality. Like there is one personality, and then there is a totally different, distinct personality. That is not schizophrenia. That is a personality disorder. And according to most studies, a lot of people who've gone through a traumatic episode in their life and they're trying to run away from the trauma will mostly exhibit this kind of personality disorder. So they will have multiple personalities in which at some point they are this person and the next they are this person. And if that person is your friend, you are always confused between their two personalities. So yes, we have dissociative identity disorder, or DIP, which is also the multiple personality disorder, and then we have schizophrenia as a psychotic disorder. Yes.
Okay, and allow me to take you back on the hallucination part. When you talk about these voices coming in your brain, in your head, what kind of voices are we talking about? Because sometimes I'm sure it has ever happened to you. I think to everyone, you just feel you want to do something, but then something tells you, usifanye hiyo kitu. Does that maybe define also schizophrenia, or because it's a voice?
Maureen, there is a conscience that informs decision making sometimes, okay? When a person has a healthy part of the personality, we call the superego part, okay? Our personality is made up of the id, the ego, and the superego. So when a person has a healthy superego, they'll develop something we call a healthy conscience, okay? So the conscience is that one that you're telling me when you want to do something, and then something inside you will be telling you, no, that one is not right. When we talk about hallucinations, and in this case, we have visual hallucinations, we have auditory hallucinations, and we have other forms of hallucinations. So visual is the seeing. You're seated there. It's just me and you in the studio, but you can see other people that I can't see, okay? That is a visual hallucination. Then we have the auditory. Now, when it comes to the auditory, we also have the auditory that is from outside, and that one that is from within your head. So you can hear voices that are external, like somebody standing here and talking to you, or you can hear voices that are inside your head.
Okay.
Yes. So when you talk about people hearing voices, it is actual voices. It is not that conscience telling you this is wrong, this is no. It is actual voices. You see the way you hear your friend calling you Maureen. Hey, you're seated here and you're hearing Maureen, and you're like, what's happening? Me? Yeah. So we could now explain that as an auditory hallucination. So it is not something, it's not that convincing conscience in you. No, it's a voice. A voice.
Okay.
Yes.
All right. And thank you for explaining that hallucination part, because I know people who take drugs, of course, they experience hallucination. And we will talk about more on that. But before we continue, I mean, we talk about the symptoms and what are some of the causes. Tell us, what are the types of schizophrenia?
Okay. Our current categorization, we have some very common types, and we have some not very common types. We have types of schizophrenia like paranoid schizophrenia. This will be majorly characterized by, again, I'm sure you've ever heard the word paranoia.
Yeah, of course.
So there will be a lot of that. We have hebephrenic schizophrenia, or what we'll call disorganized schizophrenia. This will be characterized by, of course, all those positive and negative symptoms. Let me just clarify something before I continue. We have what we call positive symptoms of schizophrenia and negative symptoms of schizophrenia. Positive symptoms of schizophrenia are symptoms that are only present in people with schizophrenia, but they are not present in the normal population. Things like hearing voices. The normal population doesn't hear voices, but then a person with schizophrenia will be hearing voices. Things like those visual hallucinations, things like delusions. Okay, those are positive symptoms. Then we have what we call negative symptoms of schizophrenia. Negative symptoms are a person with schizophrenia will not maybe be able to observe their hygiene. Okay, they'll not be able to express their emotions as expected, you know. They will not be able to have maybe proper ways of communication. So those are negative symptoms. They are present in the normal defined person, but they are absent in a person with schizophrenia. Yeah, so back to the types. I've talked about paranoid, then I've talked about the disorganized schizophrenia. We also have what we call catatonic schizophrenia. There are people with schizophrenia who will also be exhibiting, bizarre motor behaviors. Maybe somebody will stand somewhere and then they'll either do some repetitive, funny bodily actions, or just stand and gaze and have that kind of some motor. When I talk about motor, I'm talking about the body. So yeah, which is not normal. Yes. Then we also have we have other types of schizophrenia that are not very normal, very common. Sorry. We have something like residual schizophrenia, a person who's had historically schizophrenia being diagnosed in them, but over the period of time, probably they've been under very good management. So yes, there is that residual, you know, from the word residual, there is that show that there was schizophrenia, but now the person is much better than the way they were. And maybe there are some negative symptoms that are still exhibited here and there. We have an identified schizophrenia. This is portraying all other symptoms of schizophrenia in the various categories, but then cannot be specifically, you know, put in one given cluster. Yes. So there are also there's a schizophrenia that's also characterized by having like body sensations, you know, body sensations that normal people are not experiencing. So yes, we have those various types of schizophrenia. Yeah.
All right. Thank you so much, Veronica. And what causes this schizophrenia?
Currently, the exact cause of schizophrenia has not been put to book. Let me put it like that. Researchers all over the world have not been able to pin this is the cause of schizophrenia. But with that, we have predisposing factors. One of the predisposing factors is, of course, genetic predisposition. And you can bear me witness that in a family where there was a history of schizophrenia, sometimes you always see it repeating itself. Yeah, somewhere along the generation. Then we also have things like the central nervous viral infections. Yeah. That is has also been seen sometimes to cause schizophrenia. We also have, according to research, things like obstetric complications, you know, before birth, you know, a lot of things happening before birth. And we also have what we call drug-induced psychosis. Person who's been using drugs for a very long time, and yes, so those are some of the predisposing factors. Yes.
All right. I was watching a certain documentary on this schizophrenia, and there was this lady who has been diagnosed with schizophrenia, and she was afraid of getting pregnant because, as you talked about, the genetic factor, it can also maybe predispose you to having this schizophrenia. And what are the chances of a pregnant schizophrenia mother passing it to the unborn child or the baby?
I wouldn't quite put a figure to it, but given this, how genetic predispositions are used to predict the likelihood of them being passed from one generation to another, we see that it is not obvious that just because she's got schizophrenia, her child is going to get schizophrenia. When you go to genetics, when you study those genetic, transmissions, even in a family of people who used to, like, for example, drink alcohol, you will find that it is not everybody who is in that genogram will be drinking alcohol, isn't it? So it is not specified, or it is not obvious that because she has schizophrenia, her child will have schizophrenia. So there are a lot of factors to take into consideration. Which one is dominant gene, which one is recessive. There are a lot of things to take into consideration. Yeah, so it is not obvious that just because she has schizophrenia, her child must have schizophrenia.
All right. When you talk about maybe a person in the family who takes alcohol a lot, most of the people born in such kind of families, they try when they grow up to break down the chain. And of course, that's what happens in life. Let's get back to our topic on this schizophrenia. What are some of the symptoms, or what are the symptoms of having this schizophrenia?
Remember, I've talked about the positive and the negative symptoms. So let's break down a bit of the positive symptoms. When we talk about things like delusions, I've said delusions are distorted belief systems, okay? So we have also, again, some types of delusions. We could have delusions of something like grandiosity. A person has these beliefs that they are this very big, important person, okay? We have delusions of persecution. Somebody is constantly having these beliefs that people are out to harm them, and most of the time people with these beliefs of persecution, they're always on a kind of defense mode, because of course in their mind they already believe that anything being done towards them is geared towards harming them. We have delusions of religiosity. Sometimes a person believes, as I told you, they are Jesus Christ, and they are there and they believe, and there's nothing you can tell them yes, to change that. So we have various types of delusions. When we come again to hallucinations, we have the visual hallucinations, we have the auditory hallucinations, we have hallucinations of feeling things crawling on your skin, and a person is sensing that, and there's nothing on the skin, but a person is able to sense that. So we have those types of hallucinations. We have various types of disorganizations in people with schizophrenia, disorganized speech, disorganized behaviors, we have inability to observe a person's hygiene, poor reasoning and judgment. When I talk about reasoning and judgment, is somebody is not able to to make reasonable judgment. You will see a person on the road taking a shower, not really a shower, okay, bathing, yeah, with the water on maybe the trench, and it is in a busy road. So of course, a normal person will not go remove their clothes and do that. Then,
but when you talk about, let me just interrupt you on that. When you talk about the normal person, we have the street people who bathe along the road.
Maureen, the human instinct. Let me take you back to the definition of psychosis: being out of touch with reality. What is reality? Reality is also knowing that I am responsible of myself, for myself, isn't it? So I cannot expose myself on that roadside. Maureen, even these people maybe who live in the streets will wait until night, maybe, so that people are not passing.
Sure.
Then they can do their bathing. But a person with schizophrenia is not able to reason that you're looking at them.
They won't
They are
mind.
not there. So they will just atatoangona ataoga, and people are passing because there's no that ability to fathom the fact that I'm not supposed to be doing this at this particular moment. Yes.
All right.
So in a nutshell, those are some of the symptoms. Sometimes when a person is young, like I said, in boys it can be detected a bit earlier than in girls. So all the way from around 15 years, you'll start even, because of the poor reasoning and judgment, there'll be some forms of truancy, maybe stealing, very abusive, maybe emotional, inability to manage emotions. Yes, so there are all those types of symptoms.
Okay.
Yes.
Ah, that's quite interesting on this topic. And I think we're going to take a very short break right now. But when we come back, you'll tell us how do people need to pay attention on this schizophrenia, and how can you tell a person is having this schizophrenia, and of course the early signs, the diagnosis, and the medication, of course, used in this treatment on schizophrenia. All right, thank you so much. That is Veronica Maweu, who is a mental health practitioner, and she's helping us to understand and to demystify this conversation on schizophrenia. And we're going to take a very short break, but when we come back, we have much more on this conversation. Stay tuned on our Health Corner show right here on Capuchin TV with me, Maureen Kimani.
Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth.
Capuchin TV, kitambulisho Katoliki.
The Lord's Prayer. Our Father, who is in heaven, hallowed be your name. Your kingdom come, your will be done on earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses, as we forgive those who trespass against us. And lead us not into temptation, but deliver us from evil.
To get Lord's Prayer as your Skiza tune, send Skiza followed by code 738-102-64 and send it to 811.
Christianity. In everything, do to others as you would have them do to you, for this is the law and prophets. Islam. No one of you truly believes until you wish for others what you wish for yourself. Judaism. What is hateful to you, do not do to your neighbor. This is the whole Torah. All the rest is commentary. Baha'i faith. Lay not on any soul a load that you would not wish to be laid upon you, and desire not for anyone the things you would not desire for yourself. Buddhism. Treat not others in ways that you yourself would find hurtful. Hinduism. This is the sum of duty. Do not do to others what would cause pain if done to you.
Capuchin TV, your Catholic identity. Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth.
Very good morning, dear viewer. Welcome back to our Health Corner show right here on Capuchin TV with me, Maureen Kimani. And today we are talking about schizophrenia. That's our discussion today. And on our first part, we've been able to see some of the information about this schizophrenia. Who does it affect? And what is the difference between schizophrenia and multiple personalities? And of course, the name itself, because actually someone asked me, does this schizophrenia have a Swahili word? I don't know if you have, and in case you know about it, you can tell us down on the comments below, and of course we'll be using it maybe later or next time. But welcome back to the conversation, and joining me in the studio we have our guest, Veronica Maweu, who is a mental health practitioner. Welcome back. Yes, Veronica. Let's continue with a conversation on schizophrenia. We've talked about the signs and symptoms of this schizophrenia. And what are some of the early symptoms of schizophrenia?
Okay. The early signs and symptoms of schizophrenia, let me categorize them in terms of children, adolescents, and adults. Now, with children, it can be a bit difficult to detect whether a person has schizophrenia. But when we see things like delayed development, of course, it will not necessarily tell us the schizophrenia, but then that should put a question mark in a parent. Let me follow up and try and see if my child has a problem. So yeah, we could talk about delayed developmental milestones. Yeah, when it comes to adolescents, this is where you will notice a lot of inability to cope with, like for example, these are people who are in school. Okay, so there'll be inability to stay in class, maybe through inability to focus on what it is maybe they are doing in class, inability to socially engage with other children in school, because again, adolescents are in high school, isn't it? Yeah, so there'll be that inability. There'll be that inability maybe to have some hobbies that you have You know, this is a person who is always maybe alone, isolated, or rather very agitated at times, unable to maybe even complete assignments given to them. There's a lot of difficulty in associating with what they're supposed to be doing at that particular period in their life. So that could be an early sign. And then when it comes to adults, of course, adults are people we can take for assessment and now certify there is schizophrenia or there's no schizophrenia. But we can see a lot of anxiety. Again, anxiety is a very big topic, but we can see a lot of anxiety as an early sign. We can see a lot of problem-solving difficulties, inability to make a decision, or being very indecisive. You know, a person needs to make a certain decision, and there's a lot of difficulty in just. Why did you laugh?
Because I know women are affected with being indecisive.
Yeah, so there are so many disorders that have similar symptoms. So we are just we're not saying that all women who are indecisive have schizo, but there will be that indecisiveness. There will be emotional problems, inability maybe to manage emotions or even to show emotions. Somebody is not in touch with their emotions. Okay, somebody is happy when people are supposed to be crying. Somebody is crying when people are supposed to be happy. But again, remember, these symptoms overlap. These signs also overlap with so many other disorders. So again, the only sure way is to go for an assessment. Okay. Yeah, but those could be some of the early signs.
All right, so we've been able to talk about the causes and the symptoms of schizophrenia. After that, how is this schizophrenia diagnosed?
Yeah, so we have a lot of tests and assessments. Now, remember I said there are changes in the structure of the brain, okay? So sometimes, in most of these very well-developed countries, I'm not saying our country is not well-developed, but in most of those, let's say, Western countries, there'll be some imaging, you know, brain imaging that could detect schizophrenia. We can also run tests to rule out any other issue, okay? We can run urine tests and drug tests to rule out drugs. Because again, remember, I told you, these symptoms will overlap. A person who is withdrawing from certain drugs, or a person who is high on certain drugs, will also exhibit symptoms that may look like hallucinations, may look like delusions, will have all these mood instabilities, disorganized behaviors, the inability to observe their hygiene. So yes, we must also run the test to rule out. And then we also have certain assessments where you can engage a person, you can run a mental status assessment. These are mostly run by the mental health practitioners and other subsequent assessments, so that by the time you are actually diagnosing that this is schizophrenia, you've ruled out every other possibility of it being something different. With the DSM-5, these symptoms must have occurred for not less than a period of 6 months. So that again, you don't rush to diagnosing a person and it wasn't schizophrenia. Because once you put a label, on a person, remember, it can have a very significant effect on the person and their family. So of course, your doctor, your professional, your mental health practitioner is not just going to run to give you a diagnosis or a name. They will have to run enough assessments and tests, pick enough history, just to rule out anything else that could be presenting those symptoms before they can put out that diagnosis. Yes. Remember, it's a diagnosis that is also associated with a lot of stigma. So
I was about to ask you that question.
Yeah.
Because in your expertise, in your area of expertise, have you ever experienced maybe people with schizophrenia that faced stigma?
Yes, they do. In fact, a lot of people with residual schizophrenia, they won't even want other people to know that they've had schizophrenia before. Because when people look at people with schizophrenia, they look at them as, you know, the connotation of madman, crazy, I don't know, you know, those words. They fail to realize that this is a condition, just like any other condition. Just because one person is suffering diabetes and the other person is suffering schizophrenia doesn't make the person with the diabetes have a right to suffer from diabetes, and the person with schizophrenia doesn't have a right to suffer from schizophrenia. Both of these are just conditions. It's only that this one is a medical and the other one is a mental condition. But they are both conditions. Both people are unwell, they are sick. And in our African culture, apparently, schizophrenia is associated with what? Curses, you know, a lot of
bad stuff and...
Yeah. So a lot of people do suffer from stigma when they are diagnosed with schizophrenia. And most of the time, families will try to hide. In fact, why, according to WHO, a lot of people with schizophrenia don't get treatment. Why? Stigma.
Trying to hide it.
Yes. Family has hidden and is trying to look for every other solution that will be done when the person is hidden. So there is a lot of stigma with schizo, yeah.
And does it have cure?
Let me say schizophrenia is a chronic condition. So with chronic conditions, they are defined as lifelong conditions. That is why at some point I told you about what we call residual schizophrenia. This person is currently functioning, okay? But they have a history of diagnosis of schizophrenia. Rather, they have been diagnosed with schizophrenia before. People can manage schizophrenia and lead normal functional lives even after suffering from schizophrenia. So a lot of the management, or rather the treatment for schizophrenia will involve pharmacotherapy, that is the use of medications. Then it will involve psychotherapy, that is the use of cognitive therapy. And then it will involve sometimes social rehabilitation. Social rehabilitation is they will maybe have to be confined in an institution for a given period of time so that they can be under observation by professionals just for a period of time. During this period, of course, the other two that I've mentioned, that is the medical treatment and the cognitive therapy, are going on. The medical treatment is going to help us solve a lot of, you know, all that brain chemistry problems that I told you that will occur with schizophrenia. And then the cognitive therapies are going to help the person start developing coping skills and learning new skills to manage themselves. Because remember, a person with schizophrenia got to a point where sometimes they're not able even to take a shower. Sometimes they're not able to you know, dress properly, okay? They're not able to know, I'm supposed to brush my teeth this time. I'm supposed to eat because of ABCD, you know. I'm supposed to avoid dirty things because of ABCD. So the cognitive therapy is there to now also kind of psychoeducate them after now the medication has stabilized them to a level where they're able to now absorb the cognitive therapy.
All right.
Yeah, so we have a combination. There must be a combination of pharmacotherapy, psychotherapy, and sometimes, if need be, that social rehabilitation. Yes.
Okay, tell us which are some of the medication that are used to treat this schizophrenia, and of course, how can people with schizophrenia manage these symptoms?
Okay. So the drugs, okay, let me not use the word drugs. The medicine used to treat schizophrenia are the antipsychotic medications. I will not go into the specific ones because there are so many and they are both tablets form or even injection form, and your doctor will advise after assessment, after seeing your history, after knowing what you're suffering from, then they'll be able to advise the best kind of treatment to put you on. Sometimes it can even be a combination of tablets and injections. So how a person can manage is, of course, adhere to medication. That is, sometimes they're not the ones able to do this for themselves, so the person taking care of the patient needs to ensure that the patient is taking the medication. If they need to go for therapy, they have gotten to that point where they can now go for therapy. The person taking care of the patient needs to ensure that the patient has gone for therapy, and sometimes accompany them. Let them feel that support, okay? A person also needs to ensure that they start encouraging them and helping them to do those small things, yeah? Some of the people who suffer from schizophrenia, they know they're different. So they're already able to pick when you're treating them differently. And that does actually affect their self-esteem because they didn't wish the disorder. One of my clients a time back told me, I didn't wish this disorder on myself. So, yeah, treat them well and support them. Yeah.
I was actually wanted to ask you, how can people in the society, in the family, help people with schizophrenia? Because we talked about having that stigma. How can we help them to maneuver and to manage and to feel, loved and cared for?
And accepted, yeah.
Exactly.
The first thing family or even loved ones need to understand is that schizophrenia is a condition. And the person suffering schizophrenia didn't wish the disorder upon themselves. It just came. Just like people will have malaria, they'll have, TB, they'll have so many other diseases that people encounter. The person didn't wish schizophrenia on themselves. So family must get to that point where they, number one, accept huyu wetu ni mgonjwa, full stop. Then from there, now once you understand and accept that your person is sick, you have that feeling to help your sick person, to treat your sick person, to work and support your sick person. Because any other person who is sick in the family, Maureen, those other disorders, people will be wanting to be there for them, to clean them, to feed them, because they've already accepted it's a disease. So even with schizophrenia, the first point is for family to understand and accept that there is this disease called schizophrenia. Then from there, now once our person has been diagnosed with schizophrenia, let us work in close contact with the practitioners. Let us work in close contact with the doctor, with the therapist working with this person, if it's a medical social worker working with this person, whoever is the practitioner accompanying this person in recovery of schizophrenia. Let us work with them. Let them advise us on what to do, and let us also embrace this person. Start also showing them love. They might say things to you that are not making sense, but sometimes look like you have understood. I've done this with my patients before, where a patient will feel understood because you know very well they are gibberish, but you
listen.
Yes, you listen. You just sit there, you allow them to talk, and they start picking that Maureen is listening to me. So I am normal because Maureen is getting what I am saying. Sure. But the minute they start talking and then you're like, kwenda huko wewe unaongea vitu hazieleweki, they can read, they can see that. And they didn't wish the disease upon themselves. So that will just push them further and further away.
And of course, they have feelings too.
They do, yes, they do have feelings.
Okay.
Yeah.
And I wouldn't want us to end this conversation without asking you this question, because I know there's a lot of misconception on schizophrenia. Yeah. What are some of the myths of schizophrenia?
Maybe you've heard about the myths out there, because myths are what people will be murmuring in the society behind. Some of those ones I've heard is schizophrenia ni kuona tu mavitu. No, it is not only kuona mavitu. Kuona mavitu, as I said, is visual hallucinations. But you also have so many other symptoms of schizophrenia. Other people will say schizophrenia is only being delusional. ni kufikiria, you know, there's this common joke, that a president went to Mathare. One of our presidents went to Mathare, and Mathare was being commissioned, and so the people inside there asked the president, so who are you? And the president said, you don't know me, I'm the president of the Republic of Kenya. And one of the person there inside told them, no, you will get well. I also came here believing I was the president. So some people, one of the myths is that people will only believe they are, it is delusions, but no, again, it has a lot of other symptoms. Another myth is that people never get well. No, people do get well with schizophrenia. We have so many functioning people who have suffered schizophrenia before. I was reading online about it, and a lot of celebrities, it is on the internet.
True.
They have actually managed and understood and learned how to live with schizophrenia. Yes.
And I think the good thing with the world that we are in today is that people are, you know, involving and creating awareness. Yes, I've suffered schizophrenia, and right now I'm doing very okay. In case you're, you know, just creating awareness as we are doing here in Capuchin TV to our viewers. And of course, tell us, what is your parting shot on this schizophrenia, and what should people do by paying attention to other people, their behaviors, you know, whatever they share? What do you say as we wind up the show?
Let's pay attention to our loved ones. Let us pay attention to our kids as they grow up again. Let us not just see behaviors and ignore them. Let us also have an avenue where our children talk to us. Let us go for mental health checkups, because people go for a lot of physical health checkups, but mental health people don't go. And it's one of the biggest problems we have currently in the world. And also, let us take care of our mental health. Jipende, okay? Ukijipenda, utaanza kuangalia ni mambo gani yanayokufanya usikue happy. Take care of yourself. Go for therapy. Therapy is not expensive. Go for therapy. Work on some of your childhood trauma, some of the things that you went through. Work on your addictions, because addictions are unhealthy, and substance use disorders can also lead to psychosis. And be prayerful. Be prayerful. There are a lot of symptoms of psychosis that were mentioned in the Bible. Things like people who are just living in the graveyard, and you know, there are many things that have been mentioned in the Bible that when we come to currently in the medical field, there are also some of the signs and symptoms, anxieties and all that. So be prayerful, pray for your person who is sick, and also support them, love them, and realize it's also a condition.
Well said. And I don't think I have much to add, because you've been able to, you know, enlighten our viewers and to explain more about this conversation on schizophrenia. And of course, we say thank you for always, you know, making time to come in to share your knowledge to our viewers, and may God bless you too. Thank you so much to you, dear viewer, for staying tuned to our conversation, and of course our Health Corner show right here on Capuchin TV with me, Maureen, Kimani. And of course, we've come to the end of the show. I'd like to say thank you to our guest today, and of course she's always been here for how long now?
Since April, yeah.
All right, thank you so much for always making time. That is Veronica Mweu, who is the mental health practitioner. Thank you so much, and may God bless you. And I would like to say thank you to the team that has been behind the camera. God bless you too, Capuchin TV. Asanteni sana, mbarikiwe, and have a good day. See you next time.
Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth.